Hello everyone, I'm Priya George. I'm GP in Shropshire and I'm also clinical lead Shropshire, Telford and Wrekin CCG for Equality, Diversity and Inclusion.
Hi, my name is Reverend Zoe Hemming and I am the Vicar of St Andrew's Church in Church Aston on the edge of Newport, and I am the Disability Advisor for the Diocese of Lichfield. What are the benefits of having the vaccine?
Vaccines are the way out of this pandemic. An effective vaccine is the best way to protect people from coronavirus. It will reduce your chance of becoming seriously ill.
Will the vaccine give me COVID-19?
The vaccine cannot give you the COVID-19 infection. It will reduce your chance of becoming seriously ill with COVID-19.
Are vaccines safe?
Yes, absolutely. The NHS will not offer any COVID-19 vaccinations to the public until independent experts have approved that it is safe to do so. The MHRA, which is the official UK regulator, have said that both vaccines we currently have available to us have good safety profiles and offer a high level of protection, and we have full confidence in their expert judgment and processes.
Are there any side effects of the vaccine?
Like all medicines, vaccines can cause side effects. Most of these are mild and short-term, and not everyone gets them. The vast majority of reported side effects are mild and short-lasting, reflecting a normal immune response to vaccines, which includes a sore arm, fatigue, headache, and a mild temperature.
What are the types of vaccines?
Pfizer, BioNTech, and Oxford AstraZeneca COVID-19 vaccines are now available for use. Both these vaccines have been shown to be safe and offer high levels of protection and have been given regulatory approval by the MHRA.
Can I choose a specific vaccine?
No. Any vaccines that the NHS will provide will have been approved because they pass the MHRA tests on safety and efficacy, as I said before. So people should be assured that whatever vaccine they're getting, it is safe and effective.
What is in the vaccine?
A detailed review of the vaccines and the ingredients have been provided by the MHRA and can be found on the UK government's website. All patients will be provided with information on the vaccine they have received.
Can I refuse the vaccine?
Yes, but COVID-19 is a terrible disease, so if you are offered the vaccine, please have it. An effective vaccine is the best way to protect people from coronavirus. It will reduce your chance of becoming seriously ill.
Who can't have the vaccine?
There are very few individuals who cannot receive the COVID-19 vaccines. The vaccine should not be given to those who have had a previous systemic allergic reaction that is more serious than just a local reaction like a rash, including immediate onset anaphylaxis, which has occurred to a previous dose of the same COVID-19 vaccine or any component of the COVID-19 vaccine being offered, or to individuals with current COVID-19 infection or history of the infection within last 4 weeks. The other criteria is severe illness and or high fever on the day the vaccination has been given.
How many doses do I have to have, and do I have to repeat the vaccination every year?
You should have 2 doses up to 12 weeks apart for either of those vaccines, because the evidence from the clinical trials show that this gives the maximum level of protection. COVID-19 is a new infection and close observation by experts continues. At this stage, it is unclear whether the vaccine will need to be given yearly, like the flu vaccine, or less frequently.
Have the efficacy and safety of the vaccine been tested in different diseases? For example, hypertension, heart disease, asthma, and cancer?
For both vaccines, trial participants included a range of those from various ages, immunocompromised, and those with underlying health conditions. Details of trial participants for both vaccines are published online on the UK government's website.
If I am young and in good health, do I really need the vaccine?
Everyone should have the vaccine when it is their turn to be offered one by the NHS. Vaccines are the way out of this pandemic, and an effective vaccine is the best way to protect people from coronavirus.
If I've had COVID, do I still need to be vaccinated?
We don't yet know how long immunity lasts after having been infected with COVID-19, so getting vaccinated is just as important for those who have already had it or as it is for those who haven't.
What would you say to people from ethnic minorities who lack confidence in the experts?
We need to recognize that some people may have some concerns. Historically, these communities have not been treated with the care they deserved or were entitled to. The vaccines are the best way to prevent people getting very ill if they do catch the virus. They have been thoroughly tested, and most importantly, they offer protection from the most severe impacts of COVID-19.
Are there any animal ingredients in this vaccine?
The approved COVID-19 vaccines do not contain any animal products or egg.
Is there any alcohol in the vaccine?
AstraZeneca vaccines contain a tiny amount of alcohol, which is 0.002 milligrams of ethanol per 0.5 ml dose. This is less than in most foods, including bread.
Does your DNA change when you've had the vaccine?
No, the vaccines do not alter your DNA. One of the vaccines comprise of the messenger RNA that gives the body instructions on how to make proteins on the surface of the virus. This does not alter your DNA, but teaches your body an immune response to COVID-19 in case you're exposed.
Do the vaccines contain a microchip so that the authorities or others can trace people?
No, this is a myth. The vaccines do not contain a tracker or microchip.
Do the vaccines contain fetal cells?
No, they don't. COVID-19 vaccines do not contain any fetal cells. A detailed review of the vaccines and the ingredients has been provided by the MHRA and can be found on the UK government's website.
Can someone who suffers with allergies have the vaccine?
You should tell healthcare staff before you're vaccinated if you have ever had a serious allergic reaction. You should not have the COVID-19 vaccine if you have ever had a serious allergic reaction, including anaphylaxis, to a previous dose of the same vaccine or any of the ingredients in the vaccine.
Can pregnant women have the vaccine?
If you are pregnant, there is no evidence that the COVID-19 vaccine is unsafe, but more evidence is needed before you can be routinely offered the vaccine. So the Joint Committee on Vaccination and Immunization recommends that you may be able to have the vaccine if you're pregnant and at high risk of getting COVID-19 because of where you work, or have a health condition that means you are at high risk of serious complications from the virus.
Should women who are planning to have children have the vaccine?
Women who are trying to become pregnant do not need to avoid pregnancy after having the vaccine. The vaccine cannot give you or your baby COVID-19. This is supported by the Royal College of Obstetricians and Gynecologists and the Royal College of Midwifery, who say there is no evidence to suggest that COVID-19 vaccines will affect fertility. Claims of any effect of COVID-19 vaccination on fertility are speculative and not supported by any data. More information can be found on their website.
Should women who are breastfeeding have the vaccine?
The Joint Committee on Vaccination and Immunization advises that there is no known risk in giving these vaccines to breastfeeding women. Breastfeeding women should therefore be offered the vaccination if they are eligible.
In what order are people receiving the vaccine?
The NHS is contacting people in the priority groups when it is their turn to receive the vaccine. People are being called forward to who meet the criteria, which is based on expert advice from the Joint Committee on Vaccination and Immunization recommendations.
How can people book an appointment to get a vaccine?
Please don't contact the NHS to seek a vaccine. The NHS will contact you. When we do contact you, please attend your booked appointments and please continue to follow all the guidelines to control the virus and save lives.
After the vaccine, what do I need to do?
While the vaccination prevents the development of the infection in around 90 to 95% of people, there is still a chance of contracting the virus or transmission to others. It is therefore very important to continue wearing a mask, social distancing, and practicing good hand hygiene.